This is how desperate the Republicans are. They are starting to whisper here in Washington about bipartisanship. Yes, they might actually need some Democratic votes to pass some kind of health care law and to make some progress on other issues. Now, you wouldn't think that would be necessary. Why? Because the GOP controls the White House, the Senate, and the House. And usually when voters give one party control of all the levers of government here inside the Beltway, they start pushing through legislation. Obviously, that hasn't been the case. There's a lot of complicated reasons why. For one thing, there's a gap on the issues between President Trump and the Republican establishment and the Republican conservative wing. And we see this playing out in health care. There's also deep divisions within the party. The conservatives and the moderates both hate the Senate health care bill. They both object to major parts of it. It's either too much government spending and government intrusion on one hand, or it's too much pain being inflicted potentially on people who would lose their coverage or lose their Medicaid benefits on the other hand. And so that's why Mitch McConnell had to pull the bill, and the prospects are uncertain at least. Now, you know, often what happens in these situations is you reach across the aisle and you get a few votes from the other party. But the Democrats are not cooperating. They're hanging together. They're doing exactly what the GOP did in 2009 and 2010 when it was Barack Obama's party that was trying to push through the health care law that bears his name. And so the Democrats' price is, yeah, you want some cooperation for us? Preserve most of Obamacare. We'll make some changes, and then they'll declare victory. That's hard to see that happening after 7 years of Republican promises to repeal and replace the law. But this goes far beyond health care because health care has sort of backed up everything in the pipeline. There has been no progress on tax cuts and tax reform. There's been no progress on a big infrastructure program the president has talked about. There hasn't been a single brick laid for the border wall, and Republicans have the additional headache of having to get enough Democratic votes or to pass or cover to pass a debt ceiling increase, which they always used to oppose because it's painful for the party that's running things to have to do that, because it's an admission of more government spending, but the alternative is a government default. So what we're seeing here is the Republicans still struggling to make the transition from an opposition party, which they were very, very good at, to a governing party, which means that you have to incorporate lots of points of view. You've got to find some consensus. You've got to find consensus between the House and the Senate, Senate being a little more moderate and tougher because Mitch McConnell can only lose 2 Republican votes, given the tighter margins there, and getting on board with the president as well. Now, I think some of this is going to get kind of eye-glazing as Congress tries to get down into the weeds of these issues, but also there is public opinion. And for example, the health care bill the Senate's considering now has anywhere between 12% and 27% approval, according to various polls. That is not good. That is why the Republicans are hesitating to take the plunge here. But doing nothing would also be an admission of defeat. So we might be seeing some stirrings of bipartisanship, but given the toxic atmosphere here in this city, I wouldn't hold my breath.